My name is Noah. I use they, them pronouns, and I'm the program manager at IDHA. And a brief visual description, I'm a brown person with long black hair. I got pink glasses on and a brown shirt. And behind me in my background, I have a poster and a white wall. And I am the person introducing our event tonight, Radical Hope and Experiments in Care. And this is part of our Transformative Mental Health Talk series that is based on the curriculum, the Transformative Mental Health core curriculum, and uplifting some of our lovely faculty from that curriculum. So I've wanted to start it out by doing a grief and genocide acknowledgement, and we want to acknowledge the multiple genocides that are happening across the world and how that heaviness of grief, anger, rage, all the emotions that exist with us in our body minds are really welcome to be in this space and exist amongst us. So yeah, wanted to say that and give credit to Umu Saila, one of the faculty of the curriculum, for inspiring this approach to acknowledgement. So giving you an accessibility overview of the event tonight, we have closed captioning available, and so you can see that at the bottom of your screen if you turn this on. You can also access a full live transcript by clicking full transcript on below. And we also have ASL interpretation, as you can see here, and we have 2 interpreters joining us tonight. So you can toggle between speaker and gallery view during the event to adjust that view. We are recording this event to share with our registrants after. So yeah, if you're not able to make it to the entire event, everyone who registered will get the link to the recording. We also have a person handling tech support. So if you have any questions related to tech, feel free to reach out to Nia-IDHA Tech with any questions. And you can also email contact@idha-nyc.org with any other questions. So in the chat, feel free to use it and engage with the panelists or one another. And we want to make sure that we are using the community agreements, the IDHA community agreements, which we'll share, and that we also, acknowledge the chat can be really active, so feel free to close it out, attend to your access needs, and we also will send out an anonymized transcript of the chat because a lot of good things are shared in the chat often. The panelists might not be able to answer all questions tonight, but we will save any that we do not get to and hope to engage with them beyond the event. So I want to share who we are. We are the Institute for the Development of Human Arts, and we are a community of current and prior mental health service users and survivors, psychiatrists, psychologists, and other clinicians, activists, and artists who come together to transform mental health care. And what we do is advance critical, effective, and scalable alternative approaches to mental health through collaborative education and community development. And we're unique by integrating experiential and academic knowledge together. We challenge the idea that only those who work in the fields of mental health are the experts, and shifting power dynamics in a system that generally only privileges professional experience. So these are the community agreements that we ask folks to abide by while you're in this space. The first one is shared expertise and wisdom, that everyone brings their own expertise so we can gain and respect each other's various experiences and expertise. Collective liberation, that overcoming oppression aids everyone's liberation. So we educate in the spirit of solidarity and we hold each other accountable without criticizing who we are as people. And lastly, we listen like allies, respect a wide diversity of choices and perspectives, and even when we disagree, we don't judge or invalidate other people's experiences. And yeah, so these agreements apply to the chat, and we have a team member to moderate and uplift these agreements. Another thing is addressing conflict and harm. So we expect polyphony, multiple truths to exist and disagreement to show up in our space. So community agreements are designed to help navigate this. And we also, want encourage people to ask, where do they feel tension in their body? Is this from learning new ideas that challenge you? Is this something that someone said or done in a space that reinforces oppression? And we also have the link to IDHA's harm response form, where you can report any harm you felt in the space that you would like IDHA team to address. So we'll put that in the chat. And we want to give credit to Spring Up for supporting the development of these approaches. So this talk and the curriculum is all about transformative mental health. So we wanted to give a foundation of what that means. So transformative mental health is IDHA's sort of approach to mental health that is a practice of personal and collective healing rooted in systemic change. And so that's thinking about the intersecting systems of oppression and their impact on our society and our bodies, minds, and communities. Experiential knowledge that our lived and embodied experiences are the most powerful form of knowledge creation. So we think that best practices of training is to be in direct collaboration with those who are most impacted. And lastly, holistic care, uplifting multiple voices and frameworks gives us a fuller understanding of mental health. And so healing is a creative process, and we must address the whole person and broader context in which they live. So with that, I'm happy to introduce our moderator for tonight. Robin Sempervirens uses they, them pronouns and is a LMSW and is a multiracial, queer, trans, non-binary therapist and artist. They have worked for over 5 years in direct and clinical services with youth, family, and adults. And their work focuses on healing trauma and building meaning through a liberatory, relational, somatic, and creative framework. Their advocacy work has focused on LGBTQIA+ identity, intergenerational resilience, housing justice, land back efforts, police and prison abolition, and other intersecting causes. So I'm so happy to introduce Robin, and I'll pass it over to you.
Thank you so much, Noah. It's a pleasure to be here with everyone today. My name's Robin, and I use they, them pronouns. My visual description, I am a light multiracial person with red hair and a nose ring. I'm currently wearing a light blue short sleeve shirt with a chunky necklace. And my background is an orange chair and a light wood bookshelf with some pothos leaves coming down the side. And I want to offer some opening remarks for today's panel. Transformative mental health means moving away from oppressive and pathologizing paradigms towards liberatory and life-affirming care. It is impossible to understand how the logic of these paradigms works without recognizing how they are embedded in interconnected systems of colonialism, carcerality, and pathology. These ideologies are built on assumptions of goodness and badness and imagine that some people usually along lines of marginalized categorization, are inherently bad and deserving of punishment, harm, and death. The foundations and current functioning of policing, much like mental health care, is to control, contain, and disappear marginalized people, whether they be Black, Indigenous, otherwise racialized, women, queer, poor, mad, and or disabled. So far in 2024, police have reportedly killed 842 people, though the real number is likely higher. Across the country, we are seeing increased efforts to criminalize poverty, from punishing survivors of violence to making sleeping outside illegal. Since 2020, over 80 Cop City style projects have been started across the country. Not only has this trend driven funds away from community programs, it seeks to address suffering through punishment and punitive means. It has a devastating impact on local communities, environments, and our collective psyche. Those of us working in transformative mental health have much to learn from movements for police and prison abolition. Abolition asks us to see the response to harm through an interdependent lens, rather than one that invisibilizes and decimates human beings. As one of my favorite Kwame Ture quotes goes, when you see people calling themselves revolutionary, always talking about destroying, 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 but never talking about building or creating, they're not revolutionary. They do not understand the first thing about revolution. It's creating. How can we imagine and practice a world where each person is given the support they need to heal from trauma, to find community, and have autonomy over their own life? Transformative justice and transformative mental health are both necessary frameworks to create a world where each person holistically matters. As transformative mental health practitioners, we must ask ourselves what we are willing to create. In the words of Miriam Kaba, we must try a million different little experiments on the journey to build a more liberated future. I'm excited to be joined tonight by 4 brilliant community members who are engaged in such experiments. From a range of perspectives and lived experiences, I'd love to now invite the panelists to introduce themselves with their name, pronouns, a brief visual description, and their thoughts on the following question. How would you describe your role in relation to mental health work? And how does this inform your approach to experimentation? And we'll start with Chaku.
Thank you, Robin. Hi, everyone. My name is Chaku Mathai. My pronouns are he and him. And in my visual image is I'm a brown-skinned man with short black hair, graying black hair. I have some graying facial hair as well. And behind me is a bookshelf and some pictures. There's a picture painting of an elephant and a baby elephant and some books. And then I'm wearing a light green shirt and some glasses. And I'm in Rochester, New York. And, you know, the question is a tough one to start, but I guess the best way I can offer it is how my relationship with mental health is also my relationship, how in terms of how I show up in the world. I found myself at always needing to I guess, try to understand how people were perceiving me, dismantle that perception, and then somehow offer the one that I was examining at the time for myself, you know, or trying to put out there for myself. That's changing all the time. So that's been my challenge. Now, in terms of mental health, that's kind of what I'm doing too. You know, I bring these experiments of changing what's already been there and bringing a new experience with the people that I bring with me. So I'll stop there. Thanks so much, Robin.
Thank you so much. And I'll pass it over to Peter.
Hello, everyone. My name is Peter Stasny. He, him are my pronouns. I'm sitting in a black chair in front of a beige and aqua wall. I'm wearing an orange shirt, glasses, don't have too much hair on top of my head, and also have some headphones. And I guess I'm light-skinned, but I don't say that I'm white. Well, it's a long story. We only have a few minutes for, so I'll begin by saying one thing. When I was like 19 years old, I found myself in front of the famous mental asylum in Vienna, where I grew up, protesting and talking about tearing it down. So the word abolition didn't exist back then, but we were interested in supplanting the institutional system. I went to medical school and became a psychiatrist, trained in the Bronx, and found myself working in a state hospital where people got locked up for all kinds of reasons. Mostly they didn't have anywhere to go and were economically struggling. I refused to work on any units that were locked. I refused to participate in the institutional rules and often got in trouble for that. But one of the things I discovered and was life-changing for me as a human and as a psychiatrist was that people started to rise up and come up with their own ideas. People that were incarcerated or happened to live in the institution came up with ideas, came up with desires and yearnings, and quickly, through a variety of activities that we did that were considered as empowering and turning the tables, meaning that people who were living there as patients became activists and providers and carers for others that had been through similar things. So we started to work with peer specialists. We connected to a national movement. And when I found myself in an auditorium in Pittsburgh in probably around 1989, with 1,000 people, all survivors of psychiatry from 50 states and territories, each one of them going up to the dais and telling their story, I was a completely transformed human. And that's been my story ever since.
Thank you, Peter. I'm going to hand it over to Arita.
Hi, everyone. My name is Arita. I use she, her pronouns. I have a virtual background with several green plants. I have long black hair. I'm wearing a brown sweater. I have brown skin, and I have hoop earrings on with a nose ring. I teach about race, gender, and sexuality at a small liberal arts college called the Evergreen State College, and also do community organizing in the Bronx, where I'm from. I'm not, when I think about the question of like my relationship to working in mental health, I'm not clinically trained, but as I often tell my students, you know, people have been supporting each other's spiritual health long before psychology became a discipline. So I teach about race, gender, and sexuality, which means I also teach about trauma and healing as a result of teaching about systemic oppression. So I think and teach a lot about the relationship between individual healing and collective liberation, healing justice and restorative justice, how our liberations are tied to each other, but also just from like an academic perspective, some of the white supremacist and patriarchal values that underpin a lot of how we think about what's normal and abnormal. And there was that question about how our work informs our approach to experimentation. And I think the work that I've done, especially in teaching, but also in community organizing, especially in the area of intimate partner violence. I'm also always asking the question, like, who is benefiting from knowledge that's produced, or from like a particular experiment, like who's benefiting, who's suffering, and like who is this for? And so I think that that's how my background has informed my approach to experimentation. Yeah, and I also think a lot about intergenerational trauma, especially in relationship to gender-based violence, and how people have coped with trauma historically, and the ways that certain ways of coping have been seen as more acceptable in different communities. And yeah, that's me.
Thank you so much. And we'll hand it over to Roxy.
Hey everyone, my name is Roxy Ehlert. I use she, her pronouns, and I am a white, queer, Jewish woman. I'm sitting in a pink room. There's a brown door behind me and some plants on a bookshelf. I'm wearing a pink shirt. I have shoulder length brown hair and some watermelon earrings on. I live on Tewa territory in Albuquerque, New Mexico, which is where I practice. And I am an artist and an art therapist and a writer, and an art therapy educator. And so one of my primary roles in the past 10 years has been working in higher education, teaching art therapy and counseling graduate students who are entering the field as new and emerging mental health professionals. And so bringing my identity as someone with lived experience as a disabled person into those spaces, and as a queer person and as a Jewish person, and just sort of navigating what it's like to try to bring an anti-oppressive framework into this very sort of traditional clinical training environment, has been a significant part of my work. And also have worked in mental health inside of mental health systems in the past, specifically with survivors of sexual violence and LGBTQ identified people, and I'm currently working in private practice. And I think, yeah, in terms of my relationship to experimentation, I think there's so much to say, and I'm excited for this question to continue to unfold in conversation with one another. I think a lot of my experiences of experimentation have to do with sort of code switching as a disabled person inside of ableist institutions that are training mental health providers in these dominant systems, and sort of all the different choices around passing and navigating saneism, et cetera, that kind of happen in that context. And so that is something that really informs a lot of where I'm coming from. And I think one thing I wanted to name is that sort of in the process of that, and in the context of this conversation, just acknowledging that like language is really important and really fraught, and that we've inherited a lot of sort of problematic and violent language and terms for thinking about these things. And so something that I'm kind of constantly working on in myself is like trying to find the right words to describe my lived experience in ways that don't perpetuate violence and harm, and just wanted to acknowledge that that's like a work in progress always, and something that I look forward to unpacking and like learning from all of you in that context. So yeah, that's me. Thanks, Robin.
Thank you all so much for those introductions. We'll go ahead and move into our discussion. The first question is, what are some of the experiments you have engaged with throughout your work? What experiments are you excited to try in the future? And feel free to jump in as you have a response.
I guess I'll take a turn and then get out of the way a minute. You know, I think one of the first experiments for me was really creating some opportunities for peer support because there wasn't anything in my area to do that. And I was young. I was a teenager after a suicide attempt and being in hospital, and from an ex-patient perspective, wasn't really being given many of those opportunities. But someone had reached out and said, "Hey, can you come and talk to the young people in this locked facility?" And so that was kind of my first opportunity to create an environment or an opportunity within a space that was carceral and was completely like not creating that space, right? And how was I going to do that? So that first experiment, resulted in some young people feeling as free as they possibly could in that space, and a therapist going, "How is this possible? How did you do that? Can you come back and do that again?" And I had said, "I don't think I can, and unless you can meet one condition." And she said, "What is that?" I said, "I'd like you to leave the room." And she said, "No, that's not something we can do." And this was in the 80s, it was 1986. And, but I kind of, 85, 86, around that time. And I knew we were onto something. And I didn't know at the same time that there were ex-patient and survivor advocates, organizing around the country, and that, a lot of these, I would come to know them, and I would get to know them over the next few years. But that first opportunity to see, because and she asked me, why do you want me to be out of the room? And I'll just say, I said, "Well, look, I don't know if you noticed, but every time one of us spoke, including myself, we looked at you first. We were trying to see, if you could handle what we had to say. So each time we decided you couldn't. So we were all speaking to each other in code. So what looked like a great conversation to you was coded language for us around what we needed from each other and what we needed to to get out on the outside." And so that's what I needed, is to be able to create spaces where we could say what was really on our minds and heal and begin that process. And so that's where we started trying to do. So that's what I still do today. So everything we've constructed since that time would get dismantled by the larger system, or, I would leave town and go, every time of that, so now I'm back in town again and having to reconstruct it again. And we're doing that with Hearing Voices Network groups inside a forensic unit at the local Rochester Psychiatric Center. And that's how we started, building that space and having people be able to kind of restore the narratives that are being told about us in that way. So I'll start there. I mean, there's a lot of other kind of ideas in my mind, but I'm curious what other people have to say.
I can go if nobody else wants to. Well, like I already mentioned, the first sort of experimentation happened when I was working in a state hospital, Bronx State Hospital to be exact. But the idea wasn't my idea. The idea was from the people who were patients there. They came up with the idea to give instead of constantly receive, to tell instead of constantly be told. So that was an enlightening discovery when one person after the other said, "Well, if I can give something to other people, that's really going to help me too." And so the idea of mutual support as a tool for self-discovery and recovery was the first experiment that I was involved with, even though I didn't initiate the experiment. I was honored to be part of that experiment. And that was around the same time. Chaco, I didn't know you were hitting that age. What's up with you? I thought you were a young man. But there's always something to look forward to. And at this part, the one thing that I'm still looking forward to in terms of an experiment, and I guess it would be really an experiment, is to create a place where people can go when they're almost at a point where they would otherwise be locked up and involuntarily hospitalized. And some people will call it a soteria house. we're lucky that New York State now has actually regulations that allow for something like that to come to be, and we might be among the first to make something like that happen in the Lower East Side. Bureaucracy, you know, I always found bureaucracy as being helpful when it wants to be, but hindering most of the other times, which is most of the time. So the money is hidden behind a wall of bureaucracy. To get it out is a pain in the behind. And we've been waiting 5 years now. We have a house, we have a building, we have people who want to do it. We have all the ingredients. And I hope next year I can tell you that it happened. That's what I'm looking forward to.
I guess I can go next. I feel like some of my experience is related to what Chaku and Peter you're both talking about, but kind of happening in a very different context, which is that about 2 years ago, I realized my own personal need for peer support in a way that I had never been able to access before. And specifically as a mental health provider who experiences mental illness, feeling really isolated in my field and feeling like there was sort of like a just a layer of stigma and silencing kind of around that experience. And I felt really clear that even though I felt really alone, I also felt really clear that I was not alone and that other people needed to access that resource. And so I created a group called Breaking the Silence, and it's specifically for mental health providers who've been labeled with mental illness. And it's been a really beautiful, very small scale experiment in what it's like to bring disabled practitioners together, and just like the range of things that people struggle with, from very kind of basic material conditions of our lives around things like, resource and skill sharing around things like medication or navigating psychiatry or medical appointments, housing, gender, looking for accommodations at work, right? Navigating capitalism, sort of all the things that impact all the sort of larger oppressive systems that impact our lives and our relationships. And that's been a really beautiful space of connection for me and something that I really want to grow. I think another place that I've experimented that has, I mean, maybe we'll talk about this a little bit later, but that has been like a site of risk taking for me has been in writing publicly about my identity as a psychiatrically disabled person within the field of art therapy specifically, and writing and publishing about those experiences has been very sort of scary and brave and necessary and complicated and confusing, and has I think been something that has opened me up to like public scrutiny and sanism, and has also opened up opportunities to connect with amazing people, including the folks here at IDHA and all of you, and just to have really open, honest conversations about disability and invisible disability and what it's like to be a practitioner trying to provide care and support when you have this like incredible wealth of lived experience and experiential knowledge that is like sort of supposed to be you're not supposed to talk about it, right? That's not supposed to be part of your identity or your practice. And so kind of navigating my way towards more and more authenticity and openness about that in my like sort of public academic career, as well as in my professional work here and in my personal life. And so I think for me, so much of the power in this work comes through relationship. And so for me, like being my most authentic and vulnerable, transparent, brave self helps me to be in right relationship with other people around me, and to connect with other disabled people is really important. So that's been part of my work.
I'm happy to go next. I really loved what you said, Roxy, about like breaking silences. And I think going to graduate school, I was really wanting to use the tools and resources of academia to support more grassroots community-led work. And a lot of that had to do with trying to break silences around gender-based violence in my community. So I was in partnership with an amazing organization in New York called Jahaji, that does work to support survivors of primarily intimate partner violence in Indo-Caribbean communities. So Guyanese, Trinidad, people who have ancestry in the South Asian subcontinent who were brought to the Caribbean under indentured labor once slavery was abolished in the Caribbean. There's an amazing book called Coolie Woman that I can put into the chat that's about how the conditions of the plantation exacerbated a lot of gender-based violence in my community, these communities. And I was really interested in how women and gender expansive people tell stories to future generations about gender-based violence and about their own experiences of violence. Also how they think about healing in ways that don't involve the police. So a lot of that work was just trying to bring women and gender expansive people across generations together in a space to break silences around violence and to share wisdom with each other about what it means to be a survivor. And also what it means to keep the kind of secrecy around being a survivor of violence, and what happens when you can't keep it secret anymore, and sometimes not out of choice, right? Sometimes it's because of living in a city where your neighbors can hear what's going on, or I think a lot of the times when we think about privilege, right, it's a lot of what privilege offers people is the ability to keep things secret and to keep things private. So I was really interested in this idea of just holding space for people to break silences around violence and to talk about what it means to be a survivor. And I think I think about that a lot. I think about what it means to share stories with future generations about healing, and to pass on stories of healing, and also about the functions of silences sometimes and why people choose to stay silent, and some of the idea of sacred knowledge, for example. So I think it's pretty amazing that in a world where we're constantly being fed information, it's still really transformative to come together and share stories with one another. And it's kind of the most ancient form of healing. But I see that as an experiment because the conditions are not always ideal for us to hold that space in a responsible way. So that's what I'll offer for now.
Thank you all so much. Moving on to our next question. In the process of engaging in care work experimentation, what risks have you taken? What challenges have you encountered? And how did these lead to learning or transformation? And I want to invite Arita or Roxy to pick that up, since it sounds like your work is really close to these questions.
Yeah, it's interesting. I feel like some of my experiences of risk taking have often felt very personal, and at the same time I recognize them as very political, and that some of what I think happens under carceral mental health systems and systems of ableism and saneism is that silencing and invisibilizing. And so sort of speaking up and like making our invisible identities known and forming alliances as disabled people is a brave and can be a risky, scary thing to do depending on the space that you're in. And yeah, I think I really loved what you said, Arita, about like telling it as an ancient form of wisdom and this idea that like it's not always safe to tell certain stories in certain spaces, or like how do we cultivate those like sacred, safer spaces where people can sort of like unburden these parts of ourselves that we have to hide, and that, you know, just recognizing that violence can take so many forms and that coercion kind of impacts all of us and can have like significant psychic impact even if we're not like able to track it or name it in the day to day. And so I think for me, one of my survival strategies has just been, you know, I just got really tired of sort of like swallowing this idea that I was just a practitioner, that I was supposed to be like on one side of a binary of like someone who's healed versus someone who's sick. And just got to this place where I felt like that was really crushing me, to kind of hide who I was and to not be open about that. And so taking the risk to be more explicit about my experiences of Satanism and ableism, specifically within academia, in my training as a therapist, and then also what I witness and observe in my work as an educator in those systems now. And just some of the stories that students will come to me and tell me, like students I don't even know will reach out and say, like, I read your work and I had no idea that I could be open about, or that it was okay to like be psychiatrically disabled and work in this field, and everyone I know tells me not to talk about it. And like just how devastating that is, and how important it is for me to like support new practitioners in just not hiding who we are. So I think that's part of the work for me. Yeah.
Yeah, the first thing that's coming to mind for me is like thinking of being an educator as a kind of care work. Um, and I think, you know, working with young people, I am witness to how hard it is to live in the world that we live in right now, for lots of different reasons. But I think actually one of the risks that I've taken and one of the challenges I've encountered is realizing when the support that I can offer someone, whether that's like a student I have or like a community member who's in need of support, is actually recognizing when the person needs community and not just me, and what it means to connect them to community. I think, yeah, we live in a world that makes it really difficult for people to ask for help. And there's so much shame around asking for help and asking for support. And that means that many of us who have been socialized to like take care of the people around us, and that's primarily like women and femmes, right? People who are socialized as women. I think it can be really hard to recognize when we need support in even being able to give to others, right? Like even just recognizing my own limiting capacities to show up for someone, and that you know, so much of what people are struggling with is not about individual failing. It's about the ways that our systems are failing us, and that we need systemic change as much as we also need community, right? And community-driven solutions to the suffering that we're seeing in the world. So I think balancing, like, you know, the idea of like thinking globally but acting locally, and figuring out like what can I do in this moment right now for this person, who I feel accountable to, but also recognizing that like individual healing is like relies on collective healing and collective liberation, and what it means to like connect someone to like an activist community around some of the you know, issues that are like the source of their suffering, or yeah, just maybe like realizing my own limitations. And yeah, I think that that's really challenging at a time when I think that like a lot of us are in survival mode, and I think like being in survival mode sometimes means like I have limited capacity to take risks, like and and people are exhausted. So I think just balancing, I think, yeah, what my desire to show up for folks and support people, and also recognizing like we don't have to hold it on our own, and actually we're not meant to hold it on our own, to hold it in community.
Peter?
Well, on a macro level, when I think of risks that I've taken, it doesn't appear at first glance that raising funds, raising money for peer support and peer-run projects would be a risky thing, but it turns out that it's a very risky thing. I've managed to help raise with many other people collaborating, many millions over the years for projects that were either led or co-led or involved peer workers. And each time the givers, especially when it's state or federal government, created an atmosphere where you constantly could run into trouble. And it was more, I didn't realize how risky it was going to be, but I kept doing it. I kept doing it because the opportunities came up. And so, and I'm still doing it, and it's really kind of scary because that's where the opportunities are to do serious stuff, but at the same time, you're going to be trapped. You're going to be trapped by the givers. It's easier when it's foundations and private sources, but when it's money, government money, you are often caught in horrible dilemmas. So I think many of the things that we did, and we're talking about peer specialists. I mean, you can't even add up all the money that's now being spent on peer specialists working in the system, because there's probably thousands of people in the system that work as peer specialists. Are they having a good time? Are they able to do what they're meant to do? Are they being supported? Are they being exploited? Are they being co-opted? So these are the things that I struggle with all my work life, professional life, and yet I'm still trying to do it. So I don't know. I guess I haven't learned, because there were many times when I said I'm going to drop it. I'm never going to take another dollar. I'm never going to go into anything like government funded again, but I'm still doing it. So stop me.
Yeah, if there's time on this question, I was thinking similarly. I love what everyone shared already. So one example, that I, not too long ago, I had been doing a lot of work, promoting peer support and a number of other initiatives around the mental health and and substance use kind of systems and carceral systems as well. But there was an opportunity that someone asked in my local town, "Hey, can you come back and apply to be a CEO of this organization, a mental health organization?" And I said, "Okay, I'll take a look at that," and I did, and then put myself in as a candidate. And then when they asked me, what would change, I told them explicitly, and I said, "Please don't hire me if you don't want to do these things." And that a lot of those things meant, really changing things like, the board composition that represents community, people of color, and people receiving services, people, survivors, ex-patients, changing the services from what they were doing to ones that were really responsive to the community, and that we didn't necessarily know what they would be, but they would also be very advocacy oriented, and that we'd be in the press and we'd be, advocating against certain things, including police involvement and in crisis response and other kinds of issues. Anyway, long story short, after making a lot of changes I got the job. And then after making a lot of changes in the first year, from management to vendor relationships to HR structures, collective, from kind of like 2 or 3 people making all the decisions to more of a collective leadership structure, and, a lot of important equity-based changes, I think. And really hearing from the grassroots, being in press conference, being in the media on the regular, opposing harmful and policies, standing up for rights-based policies. Not too long after that, a year later, they said, no, thank you. They said, we don't want this. It was now the seeds were planted, and it was probably the best work of my career at the time. I felt it was unfair, in many respects, but at the same time, they get to do that. It's the system. It's what they do, as Peter said. It's kind of the way it works. And it was a few years later that I came back, and we had to protest in the streets after Daniel Prude was killed, and the video came out, and we had to hold our community accountable every day with protests in the daytime, in the night, into the night, and propose new changes there. So I don't think the work we've done was lost in some respects, but I do know that the risks were huge. I couldn't get a job in my area after that. For example, I had to move my whole family back to New York City, sell everything. My 11-year-old had never lived in New York City before. They had, then the pandemic happened and we were in lockdown, so a lot of challenges happened there. But it was also, something we needed to do, and I was grateful to be able to do as well. So I guess I'm saying that risks of being fired, just very concretely, being an abolitionist in the space of a system that is, both medical and prison industrial complex, very much tied together, wants to believe that it's helping. And at the same time, when you are the one raising kind of consciousness and joining others to raise consciousness around what's actually happening and the harm that's happening, and then trying to create something new, people still don't want it, and so bringing people into that collective liberation that Rita, what you were talking about, is a longer process than I had even understood. Many people said to me, you were going too fast, Chuck. Well, how do you go slow in the face of injustice? In some respects, there were things like, I had a peer specialist, cheek got broken by police on his way to a recovery center on my watch, right? And so we had to be in the streets about that. We had to be explicit about what was wrong and what kind of police accountability was needed. We had to be explicit about racism and xenophobia and the kinds of issues that were affecting us. So anyway, so the risks were, yes, people won't hire you, people won't listen, people may not respect initially. But then comes what Peter said earlier was the most dangerous stage, and A.T. Yadna, a Sri Lankan advocate, says is the most dangerous stage, and that's when they give us respect. And that's the most dangerous stage because we're at risk of recreating the same qualities that outraged us in the first place. So that's the quandary we're in. When we're also working in a system who depends on our black and brown bodies for its existence. That's it. Sorry. Thank you.
Thank you so much. I think that brings in a very important question about risk as a provider as well. you know, how do you balance risking your professional degree or funds, or as someone mentioned in the chat, being a mandated reporter, when it means that some people may not get care because you're pushed out of the system? What's the fine line between, you know, placating a system so you can provide enough and also being in right relationship with your political ideals? And I wonder how folks are thinking about that.
I mean, this is something that I really struggle with a lot in terms of this, you know, comment in the chat about being a mandated reporter and like, yeah, just sort of being married to these ethical expectations on the part of these professional boards that are, you know, where I am sort of like legally and professionally expected and obligated to commit violence against people who are in crisis and like to directly harm the people that I'm working closely with. And like the idea that we do healing work in a context where we're also mandated reporters, it's complex, right? Like, especially for me when it comes to suicide and self-harm, self-injury. I don't have an answer. I just it's something that I really struggle with on the day-to-day because, you know, to some extent I can't, I sort of feel like I've taken myself out of the system or systems in strategic ways that enable me to, I think, work more effectively, and yet I can't fully escape those systems. And so I'm kind of like, yeah, just tied to these expectations and these like oppressive norms around policing other people's behavior and sort of enacting violence against people who are vulnerable and like seeking wellness and support. And it's something that like makes me really sick, and it's hard to like stay in the profession sometimes because it just feels like, what is this choice that I'm being given, and how do I like provide genuine support when people are in danger of harming themselves without leaning on carceral systems. And my experience of that is that there's just like such a profound lack of support and of community, and that like what we need relative to what we have in terms of support is like so tenuous and not enough. And that is like a really devastating thing to contend with. And I think it ties back for me to what you were saying, Arita, about like feminized labor and women and femmes and this expectation that we like take care of other people in this way that I feel like I've really, you know, can get pulled into like sort of like, I don't know, toxic like rescuer shit or like savior stuff, or this sense of like, if I don't do the thing, like it's not going to happen, or someone, you know, is really going to suffer. And just like the contradictions that you get caught in inside of that, you know, attempting to provide like ethical care, knowing that like my personal ethics are not aligned with the ethics that are expected of me in the field at large, and just like how impossible that is sometimes.
Can I go? Since we're on the subject of being in a room with one person and having conversations and exchanges about serious stuff, that we are told we're supposed to be risk managers. I refuse to be a risk manager. I tried to work with people and we talk frankly about all the stuff. And if we cannot create a situation where we have mutual trust, we have a problem. And the problem is in the room. And, you know, maybe this is, you know, kind of bragging, but I've found myself, I've most often been able to establish relationship with people and that we're trusting. Now, of course, that doesn't work in many settings. So I don't work in those settings. I would never in my life work in a place where you're supposed to, like an emergency, like a CPAP, like an emergency room, where that's what you're supposed to do, because that's just got to be continuously oppressive. It's just not a place to work. But if I work with students, which I do a lot, and I work with several universities, people come and say, what if I want to kill myself? What would you do? And then we say, you know, you and I, it's going to be on us. And sometimes I've made a commitment to never call the police on somebody, but I'm not going to tell that. And I didn't even say it now. You didn't hear me say that. Because it is risky, you know, if I work for this, if I'm employed, it's almost impossible to do this kind of stuff, because then I have a supervisor looking over my head. But if I'm my own boss, I can do a lot of stuff like that. And fortunately, you know, people think that suicide is such an extraneous thing. Everybody has thought about suicide, almost everybody in this world. And, you know, it's something, it's part of life, you know? Anyway, I could go on, but I'm just saying, I feel that you can, against all odds, build connection if you're available, if you make yourself available, if you say, well, you can always call me 24/7. You know, things like that will enhance the connection, even if in the background there's some kind of scary authority that says, well, you didn't do this, or you're supposed to do that. I don't know, there's a lot more to say about this, but I'll stop now.
Well, I'm not a licensed or educated person, you know, in that regard. Part of that is because of just not being able to, you know, from a, you know, having disabling experiences, wasn't able to continue. But then there came a point where that also became a choice for me to not have that limitation that I perceived anyway in others. You know, I preferred to be more of an organizer and more in the community space, and people kept hiring me anyway to, you know, on the inside to change things. So I was kept being surprised by that. So that seems to be the case. And what I've noticed, and I, you know, even in crisis response, what people were perceiving as a requirement really wasn't a requirement to call the police. It was just kind of what was poured in the cement, you know, in terms of practice. So I think that's worth examining wherever you are in your state, in the country or in the world, to examine what is actually required of you, including in your license and practice, and be a little clearer about what the limits are, and then being able to, like, you know, Peter was saying, being more transparent about it in both individual relationships. But I do want to say that one of the things that, licensed or not, that I always felt is that I couldn't act on all of these issues alone. I needed to be part of an organizing community. I needed to be part of a healing justice lineage and movement and set of movements and overlapping ones, and not just stay in my lane around those things. Recognize how I can be an ally in many spaces and be part of and learn from so many people about how we need each other. And so the very changes that that I was calling for, you know, personally and individually, I didn't know there were many others doing so, and I only got to know them because of, you know, needing their help and getting to know more people. So that's been an important principle for me, is really being, you know, learning from the lineage and being part of it and hearing from people, and, you know, finding my place in it, no matter how different I think my story might be.
Yeah, I'll just add to that. I think learning about alternative forms of ethics that have existed around this, and to be in community with people who are practicing alternative forms of ethics can be really powerful. I think it's really hard as an individual person to make change, but when you're with other people, it feels a lot more doable, right? And a lot more possible and sustainable. So yeah, I think connecting with those communities of people who also find, um, just who struggle with the tensions of this idea that to take something seriously means we call the police or report to a body of people who might not have our best interests in mind, right? Like going back to that question of like who's benefiting from this, like as a faculty, I'm also mandated to report like students sharing with me experiences of violence or like various mental health challenges that students are going through. And in a class on trauma and healing, I'm encouraging students to connect the material to their everyday lived experiences, to the work that they do, to the communities that they're a part of. And so I have to have an alternative form of ethics to operate in. And I have to ask myself, like, are these ethics supporting people and communities, or are they supporting an institution that is simply trying to preserve itself? So I think, just to build on what folks have already been saying about just thinking about like who's doing things differently and how can I connect with them? Because I think doing it alone also runs the risk of like reproducing the very dynamics that we're trying to fight against, and it's just really hard. I prefer to like imagine and create with other people, right? It's hard to think about like how to do something different on your own. So just lifting up the importance of connecting with folks who are trying to do something different.
Yeah, and just one more thing on that. I mean, along those lines, I mean, even with peer support, just basic peer support, people were telling me when I was 16, 17, trying to run these meetings in various places. Oh, you can't tell them that, you can't tell them this, and they were just, all I was telling people were about their rights, and about what they already had available to them, that there was a right to refuse treatment, even though if it wasn't necessarily kind of clear to the provider, at that time, didn't mean that wasn't there. There was a right to a due process in terms of being mandated into care and those kinds of things. And so how did people become aware of these things, or even just being the right to know that one could heal, and experience things in a different way than the only options that were being given to them? They needed to hear it from some of us in order to, and I needed to hear it from others too, because I would revert to an old narrative otherwise, So I think that's really powerful to have groups of practitioners and healing practitioners organized to support each other around a different framework. And the crisis model is the same way too. Like a lot of times, and says, especially in New York, we're trying to get new legislation to change the rules for when police are allowed to show up. In the meantime, while the many community responder models that are around the country many of them have had to be abolitionist run separate groups, and we're looking at that as well, the reality that sometimes we can't participate in the system because the system is still too wired together, and so that's just going to be the limitation for until new legislation is and rules are created. So that's part of why the political process has to be part of this as well. It's not just about being a different kind of practitioner in the space. That's awesome, and I think that's wonderful when people get to find you, but we need to scale that up,
Yeah, I feel like I have so many thoughts on what y'all are saying and kind of how this stuff ties together. In terms of thinking about like alternative forms of ethics and like the challenges of like trying to act ethically in isolation and what it means to try to do that in the face of like this horrible oppressive system versus doing that in community and in connection, and the ways that is like more effective, like, and just subversive in really powerful ways that have the potential to make change. And one like resource that it makes me think about is transformative mutual aid practices, or TMAPs, created by the Fireweed Collective, for folks who are familiar with that. And it's sort of like a maybe somebody else can speak to it who knows it as well, but kind of like a community, so they call it mad mapping, or this sort of like community-based tool for engaging with our own like vulnerabilities around extreme states, or sort of how do we keep ourselves safe knowing that the systems won't, and knowing that psychiatry and medicalized systems are like most often like violent and dispose of people, right? And so how do we care for one another in community, knowing that the systems are not going to care for us or keep us safe? And so these practices around sort of sharing with one another, like, what are my vulnerabilities? So I think we can take this idea of like safety planning, which is like can be like a very like clinical and sort of carceral technology, and sort of like expand that into like, and how do we care for one another? And what does it mean to like reach out for help? And like you said, like this need to ask for help. And so this idea of like, if we can democratize that process of just naming like, we're all vulnerable in this system, we all need support. Some of us may experience extreme states and others do not, but that doesn't mean that we're not all like subject to trauma and violence. And so how do we cope with that? And that by using, those kinds of mutual aid practices, we get to kind of keep each other accountable for our own wellness, and to like name out loud to someone like, if I need to be hospitalized, I don't consent to ABCD, or like, this is a medication that I refuse to take. And if I'm in a state where I'm not, able to consent or advocate for myself, like, this is what I want, right? And being able to name in advance, like, this is what I expect. And that doesn't mean that we get that necessarily, right? But that it's an important act to name it, and to name it in community. And that's a tool that we've worked with in my providers group. And I think it's really useful to just be like, let's have really real talk about like what we're up against, and how do we like keep each other safe, knowing that like we're not safe, right?
Thank you so much for the responses to that. And also thank you, Roxy, for pulling in those resources. I think those are such amazing things to have on hand. And I really encourage folks to check out PodMaps and the TMaps. Those are such amazing resources for community members, people in the field and beyond. So thank you for that. I want to move us on to a related question, which is, how do you understand the relationship between care provider experimentation and healing liberation for those experiencing mental health challenges? And for those working inside the mental health system, why is it important to create places of refuge and radical possibility? We've spoken a little bit about this, but I'm curious to hear what else you would add.
I mean, I think this is like a pretty basic thing to name, but I notice in my work, um, both as like a care receiver and a care provider, that we're really indoctrinated into believing that there are like people on one side who are like healed and have their shit together, and people on the other side who are like, suffering and vulnerable, and that there's like this us and them, and those are divided, and that the division is clear. And I think for me in my work, just being human and just being, I think it's important to like, I definitely like navigate boundaries very carefully with the people that I work with, but I think it's also important to be real, and to just, I think you can create a lot of hope for someone by like directly self-disclosing, this is my experience, or like, I have seen this happen, I have seen people survive in this way. Like, I think that we can provide such tremendous hope when we humanize ourselves, and that we're really indoctrinated into these systems that are like, no, you're supposed to be like the blank slate, or like, this like target for people's projections, and it's not about you. And it's like, of course it's about us. Of course we're in relationship. Like we heal through relationship, we experience trauma in relationship, and we heal through relationship. So if we can't like bring our, to a certain extent, like our honest, authentic selves into those interactions, like we're really robbing the people we work with of, an opportunity to like be fully seen and known, and to recognize the possibility and like reality of their own resilience.
You know, when it comes to prescribing medications and drugs, it actually turns out that if you follow the ethical guidelines, you would enable the person who you might encourage or discourage to take a drug for making a choice, would encourage them to be able to make the right choice, a better choice, an informed choice. And we're actually supposed to do that. But psychiatrists never do it. They actually almost always refrain from giving the full risk benefit, risk of not, benefit of not. And so there are many ways to be a prescriber that empower the person who is either coming to ask for something or considering it or being told to take something by other people. And all that to me is a rich field of opportunity to actually collaborate in so many different ways. I can't even begin to tell you what, and I have my own guidelines, first do no harm and then give control, and then, when it gets to longer acting, there's also hierarchy of toxicity. So there's a whole rich ethical and, if you want, medical realm that almost never gets fully employed in the service of the person who's coming for help. And so I find this, unlike the reporting requirement, this is a requirement that I agree with. I think people should fully and completely explain the option, the positive, negative, and choices. And I think that opens up a space that makes it much more likely that the person will benefit from something, or will decide not to attempt, not to try it. And that's just as fine as. So, I find sometimes the ethics are there, but we're actually avoiding to deal with them.
Yeah, and if it's okay, I just want to jump in and say, like, thank you so much for naming that, Peter. I have observed so much just this like horrifying lack of informed consent around like patient consumer of medication, and what like for me is like one of the most like primary sites of violence for many of the people that I work with, is around like just complete like negligence and malpractice, and just the real like this model that, it's a medical model, but this model that we have that like doctors know things and we don't, and like, medical knowledge, like when folks aren't given information about like, here are the benefits of this medication and here's what you can expect when you try to get off of it, right? Like, or like, let's take a holistic view of the entire experience of what it means to utilize this tool. And doctors don't do that. Doctors don't spend time with people to say, like, this is what you can expect by engaging with this form of care. And like what happens as a result is that individual people suffer tremendously because we don't have enough information and we don't have safety nets. And I've just seen that be so devastating in my own life and in the lives of other people around me. And I think it's such a massive abuse of privilege on the part of many doctors and people in the medical systems. And, how do we keep doctors accountable for that? And like I've just seen such like massive failure to accept responsibility for the violence that doctors commit against their patients, and it's a horrible thing to watch, and it's a really difficult thing to try to support around.
Thank you all for what you're sharing. One thing that brings up for me, Roxy, which I really love, is also how interdependent movements are so important. the informed consent as a trans person, like informed consent was such a radical change in my life. And if we took the learnings of how that's so impactful for people in gender affirming care and think about it in terms of psychiatric care, there's so much learning that can happen there. I love pulling in that informed consent. And so I'm going to move on to the next question, which a little bit along the same lines, which is what lenses, lineages, or frameworks inform your work, inform the work you do to experiment with shifting paradigms?
Yeah, I can jump in. I think I mentioned restorative justice and transformative justice as a lineage that has really informed how I think about addressing various forms of harm. But also this idea, I think someone mentioned the importance of like breaking false binaries between like healed and traumatized, or I think in restorative justice, the idea of oppressor and oppressed, that each of us have the capacity to harm as much as we have the capacity to be harmed. So I think that framework really allows for a lot of humility in the work that we do, and like self-reflection about I think just constantly being aware of our capacity to reproduce harm just by virtue of being socialized in the society that we live in. I think transformative justice also offers as an alternative to the prison system, a way of thinking about addressing harm that also recognizes the way that that the state can also be a perpetrator of harm, and that committing a crime, there are lots of crimes that exist that don't actually involve harm to another person. It just involves like the state losing money or something, right? So this idea that if we can commit a crime, we can commit a crime against the state, why can we also not see the state as a perpetuator of harm? So I think transformative justice and restorative justice are definitely lineages that have informed how I think about care and harm and showing up for people and healing. And also about like the root causes of suffering in our society, right? That like moving away from the idea that of like individual failing, and also the idea of this model of suffering and only being able to seek some reprieve from our suffering through the medical industrial complex. So yeah, and restorative justice and transformative justice have been created and founded by Black women, and Black women who are also abolitionists. And so this idea of like what it means to create life-affirming institutions, as we're also helping to break down institutions that are life depleting. I also have been really inspired by Indigenous perspectives on healing and what it means to decolonize trauma work. So I really recommend the book, a book by Renee Linklater. I can put their name in the chat as well, who's an Indigenous mental health provider. It's called Decolonizing Trauma Work, Indigenous Stories and Strategies. And much of what she talks about is like the importance of addressing colonialism as a root cause of suffering for many Indigenous communities and communities that are living with the ongoing legacies of colonialism. And not only the way that we address mental health in communities of color, but also what we see as normal or abnormal is very much shaped by colonialism and heteropatriarchy. I also think Indigenous practitioners have done a lot of work to remind us of the role of spirituality in mental health and healing work. And there's a psychologist, her name is Leticia Nieto, who does work in Washington State. And she looks at the presence of recreation stories in many indigenous communities, especially in Central America. So not only creation stories, right? This idea of like that many cultures have some story about how the world was created and how we came to be on this planet. But many cultures also have recreation stories, the idea of like destruction, but still having enough to start again, that there's always enough to start again. And I'm always really inspired by that idea of recreation and starting again, and that there's always enough to be able to start again.
That was great. Great. I'll just add, for me, healing justice movements, there were movements in my earlier advocacy inspired by more political organizing, like so the Black Panther Self-Defense Party was a big origin for me at one point, and in many ways still is. There was ACT UP, was in harm reduction movements, and so these were very influential in seeing that there could be a strategy, and that there needed to be a strategy centered in people's experience. Trusting, that, we had in our own mental patients space, Mental Patients Liberation Alliance. We had a variety of, in my local area, for example, George Ebert had started that in our area, and I got to know them and started to, recognize that there was a way in which, we could start to vocalize our own liberation and just define it for ourselves. So those are just a few, but and as well as those that Rita already mentioned, especially Indigenous communities, but Black Power movements, brown power movements. These were kind of central to me as I was going into the space and seeking kind of knowledge about how to actually do anything differently than what people are already doing. I just didn't have an example in front of me. There weren't even the people of color in the mental health space advocating yet. Like I couldn't, like, other than the ones that were being kind of touted around by kind of industry supported organizations. So hearing anybody speak openly against the system was rare. So I had to turn to other movements and see the parallels,
Since I think we're already on this question of what frameworks, what influences to work, and you mentioning organizations. There are organizations I could mention, but when I was 18, there was a democratic psychiatry movement in Italy that influenced us. But even more so, there were individuals, and I have to say, individuals stood out more than organizations in all these years. Howard the Harp, many of them are dead, which is sad. Judy Chamberlain, Howard the Harp, Laura Ziegler is not dead. Solveig Wilder is not dead. Darby Penny, Celia Brown. I could go on and on and on. These are people that stand out. And And the organizations, did I say Bhargavi Davar, who just recently passed? I didn't. The organization that some of them created and participated in were powerful, but they were even more powerful than the organizations as individuals. They radiated transformational energy. And that is what kept me going for the longest. Still keeps me going. Loria Hearn, Laura Prescott, Laura Delano. Now I'm going to come up with like at least 10 Lauras. You know, it's just endlessly amazing how many people. But we don't have the networks are more fragile than even the individuals, and I don't know what that's all about. And you know, we have to talk about IDHA, and IDHA has become an incredible network, and we're seeing that in this call, and we're seeing that, you know, bringing in young people into this movement, which is the most important thing. And I don't think anybody has been as successful as IDHA in doing that. So I think kudos.
Yeah, I love that, Peter. I really agree. And I know for me in my own personal life, IDHA has been like such an incredible source of just like comfort and hope and support. And having access even to the possibility of this community has been really incredible for me. And I think I just want to sort of uplift the role of disabled artists in my own politicization and looking at groups like Sins Invalid, so artists and writers, cultural workers. I think of Patty Byrne and Riva Lair, who's an incredible painter, and just a lot of Chicago-based healing justice activists who really influenced and supported me as I was starting to understand who I was as an emerging practitioner. The Fireweed Collective and Jax McNamara's work. And I also think of Mia Mingus's work around, you know, these ideas of like access, intimacy, and crypt solidarity, and like what does it mean to be in relationship with one another that uplift disability justice, like in our intimate spheres. So I found this question incredibly grounding. It felt like, you know, even when Jesse reached out to me about participating in this event, I was having an experience of really feeling like, wow, I am failing. Like I'm failing to provide the care that I'm aspiring to provide. I've created this situation that's unsustainable. Like, what am I doing? And it was really powerful, even just this, like, these words from Miriam Kaba about like a million, you know, we need a million different little experiments. It was just this incredible reframe for me of being like, oh, actually, I'm not failing. Like, I'm living inside of this failing system. And I'm like one person who's just like trying to do my best to make change. And of course, I'm like struggling and ineffective sometimes, or of course, I feel isolated, or of course, I feel like I'm failing because I'm just up against this like tremendous violence. And I'm, you know, for as much as I work to be in connection with others, there's also like a profound amount of isolation. And so like sort of connecting back to these like theorists and artists and cultural workers and scholars and just like incredible people living and working in community. And for me, you know, radical art therapists like Sandy E and others in disability justice community, it's like, okay, like I belong to something, even if I feel really alone, like I do belong somewhere and like it's gonna be okay. And that is like a thing that keeps me going.
Thank you all so much. I feel so excited hearing some of these lineages, these names. I love that Peter brought in IDHA. IDHA, of course, is such a place to receive some of this wisdom, be in community with folks. I want to shout out to my folks, in particular, Ignacio Martin Barreau and Franz Fanon, who worked in these lineages. But thought about our relationship with systems rather than just the individual within a family or an individual in their own life. And I love shouting them out because they're part of the curriculum as well. So if you want to learn more, it is a great place to go. And I'm going to move us to our last question, which is, Amid this moment of political upheaval and societal breakdown, it can often feel impossible to infuse our work with radical imagination and creativity. What strategies do you use to make this feel more approachable?
All right, I'll just kick it off here, what others have to say. So, I mean, so for me, all of those experiences are part of a, we're rivers, not statues. And this experience of upheaval and change, and, like if you're falling from a waterfall, you can feel like a single droplet of water and very isolated and unable to, do anything about it. Yet the rejoining of myself as the river is what happens at the bottom of the waterfall, and the, confluence of all of those things are a big part of what's happening. And I can be a part of that. And, who I am and what I have to say and think and believe and share and do can be a part of that new experience. And so I feel like these are all opportunities for our more radical experiences to show up and to really be seen and to be understood in a deeper way by people. I'm finding it's been, an opportunity for me too, to just personally challenge myself to be more curious about other people's stances, and perspective. And I'm feeling better at it now. I wasn't so good at it, and now like a little bit better, where I'm able to say, so can you tell me more about that? And actually have a meal with someone who has a completely opposing point of view and just fixed in their ideas, and then be able to help join together around like some concerns, and see where they're coming from, and take my shoes off in order to kind of be in theirs for a minute, just like I would, for somebody that I agree with, maybe, and so I think that there's an opportunity here. It doesn't mean I'm not saying like, that I gotta, accept oppressive behavior, or, participate in force and coercion, or, there's kind of ways in which that still has, I still have to kind of draw a line for myself, and be clear, because that's actually the only way people will see the other options, in my opinion. I have to be, the difference, um, but I think I can do it in a way that people can see and hear and, express themselves if, more than I had in the past. So I'm still working on it, speaking love and truth in the same voice. It's not a separate sentence anymore, I'm not good at it, but I'm trying.
Yeah, I can jump in, I think, just to like lift up a lot of like a theme that seems like it came up today was the idea of like leaning on other people as we're doing this work. So I always think that if I should be like working myself into not being useful anymore, like being in a space where if I leave that space, the work can continue without me needing to physically be present in that role. So it's like building systems that are sustainable and processes that are sustainable. And a lot of that requires like collective decision making and collaboration and like shared accountability. So I think that helps with the with sustainability and like making this work feel more approachable when things feel impossible and it feels like imagining something different is less immediate to us. I also have been thinking a lot about like giving myself space to fail and space to pause on things. We were talking, I think there was some talk in the chat about Tima Okun's work on white supremacy culture. And one characteristic that Okun talks about is sense of urgency. So I'm always I think it's attention, right? Some of what we were talking about earlier, Chaku, especially about like, we need, lots of what we experience in ourselves or in other people requires immediate action. And how do we balance that with, this characteristic of white supremacy culture that is about a sense of urgency, and we have to solve this problem now, and there's only one right way to solve it. And I think the idea that there's lots of different ways to address, the suffering that we see in our world, and that we're not all going to play the same role in that work, I think helps with questions of sustainability. Like, what role can I play? I might not be someone who maybe is most effective on the front lines, but maybe I'm more of a storyteller. I'm more of a, I'm like caring for people's kids while they go out and be on the front lines, or I'm like cooking for people who are like unable to cook for themselves, or so I think the work, it's important to ask ourselves, like, how are we part of a larger ecosystem of people who are trying to work towards social change, and like, what are the particular gifts that we can offer, because we can't offer everything, right? And as much as we want to like change everything, we can do that ourselves. We have to do that with other people. So yeah, that's just resonating as like a takeaway from our conversation today too.
Well, I think recently I've moved from being cautiously optimistic to being cautiously pessimistic, and I'm challenged by the increasing difficulty to separate my own oppression that I feel from events that are going on in the world, both based on that have to do with my own history and have to do with other people's history, from the spaces that people are in when they come to you for support. It's usually not so challenging to be with people without drawing them into this kind of experience that I have, and leaving them the room that they need for growing their experiences or their attitudes or their critical voices or whatever that may be, or their uncritical voices, or their so I think that's a challenge. I'm finding it more challenging now than before in the and I don't know what to do about it. I'm frankly going out to demonstrate doesn't do it for me. It's not enough. It doesn't seem like it just has a real hook. But I'm kind of feel a little bit lost, to be honest, in this cautious pessimism.
I will say, like, sitting with this question was hard for me. It feels like an emotional question, because I think it can be easy to fall into like moments of hopelessness and despair. And I think that's like just part of the reality of facing what we're facing. And like, I feel really heartened by this conversation, and like the IDHA curriculum is incredible. The transformative mental health curriculum, I've already learned so much. And just for me, the experience of like people with lived experience telling our stories and like sharing our wisdom and sharing our expertise and our scholarship as the site of expertise, and like sort of just following the leadership of disabled people, I think is so powerful. What else do I want to name? I think, yeah, I appreciated what you said, Rita, about like sort of following our gifts and the idea of existing in these like ecosystems of care, recognizing that like my experience in like pro-Palestinian organizing recently is just feeling like different people in the room bring different like gifts and care and expertise and strengths and like things that I don't know anything about. Like the person next to me can hold that and then like I can do the childcare, or like I can run the art activity, right? Whatever that may be, and really like valuing in our movements like multiplicity of roles, and like valuing work that is like traditionally overlooked or not valued, for whatever reason, whether that's, yeah, could be for many reasons. And then I think also for me, like returning to art making and really like trying to work with people in my life, whether that's in my professional practice or my students or my friends or my community, teaching, therapeutic arts workshops about just like really engaging with art and creativity, and recognizing that like we all have that capacity and we all have that as a birthright. And like, for me, like every single person is an artist, and like we all have the potential to tap into that. And I think that storytelling and art making, it's like that recreation myth. It's like that space of possibility of like what new story might we tell if we could imagine, right? Like what barriers and limitations can we sort of like move beyond in our imagination? And when we do that collectively, and just even like dare to dream, or dare to say like what's our goal in 2 years and 5 years and 10 years, like what is our long range visioning, right? Like sort of talking back to that like white supremacy urgency, and recognizing like we're in a long game, and like this is gonna extend beyond my lifetime, and like, beyond my like, yeah, it's just we're in a long game. And so I think pacing ourselves, sustaining ourselves in meaningful relationship, making art, taking action, protest, connection, rest, right? All of these things.
Thank you all.
I'm sorry.
Oh, sure. Did you want to add one thing?
Just to add a brief point around
Mhm.
one thought as people were sharing that I was, resonating with, which is that a lot of times in these times, especially in our respective movements, or at least I know I've seen it and experienced it regularly, is that there can be a tendency to turn on each other too, and to be kind of hurting and then continue the harm without necessarily having a way. So that's these approaches to restoration of ourselves in that, as in the movement, and having a framework for it, I think has been important, to bring up. Where I think we're not there yet in some respects, but I'm seeing it happen where even legislative efforts have been, very recently, and peer respite legislation was blocked by one of our own, that would have been impactful nationally, and create great opportunities. And yet the struggle, there, I think, goes back to what we've already said, but I just wanted to put that out there as, that there needs to be an approach to, making sure, and especially as Peter brought up elders that are mentors of mine as well, having some way in which we, bring the lessons learned from elders as well as from young people together. The IDHA is an example of that. So I just wanted to, just make that more explicit. Thank you.
Thank you so much. I do think that's such an important point to bring in, and a perfect way to come to a pause. So this is the end of our panel discussion, and I'll go ahead and hand it back over to Noah.
Thank you, Robin. And yeah, want to say thank you all to our panelists. I want to share that we have an exciting announcement, so please stay on if you can. But yeah, I wanted to do a huge shout out to our panelists. This was such a good conversation. I really feel like the honesty was so appreciated, and just kind of, yeah, just sharing like really what is your experiments, that what are you doing, and what are you like leaning into in this moment. So yeah, thank you, and really shout out to Robin for being a rock star moderator for this panel. So I'm going to go through a couple slides with some announcements that I would love for you all to know about. So if you liked this panel and the words from these amazing faculty, they were all faculty in the Transformative Mental Health core curriculum. Right now, fall enrollment is now open. So if you are interested in learning more about transformative mental health and engaging with these topics, I highly recommend you joining us and enrolling. So this is a curriculum that's for mental health practitioners and care workers, and also will benefit so many other people who think about mental health liberation. And it features 50 faculty, including the folks tonight from across the country and world, bridging lived experience and research and professional expertise. And there is two formats for the curriculum. So there's this learning experience format where you move together with a cohort of people for a 4-month period, meeting in 8 bi-weekly meetings. And then there's a self-paced format where you can get all the modules at the same time and move it at your own pace. It's 22 hours of pre-recorded video, and there's a bunch of different pricing points for meeting different levels of just access. And this is a picture of all of the lovely faculty, like I said, from all over the world, bridging lived experience with professional expertise. And these are some of the modules. So these are the first 1 through 4 of the modules, and I won't go too in depth, but yeah, you can kind of get a feel from the titles what they're about. And these are the 5 through 8. Once we hit module 6, it's a little more like practice oriented and applied. So it's thinking more about how some of these tools that you learn, some of these more specific experiences can be applied to the work that you do. And the curriculum, we're really happy to announce that it is eligible for CE credits, so 20.75 CE credits for psychologists, social workers, counselors, nurses, doctors. So that's like another add-on, and also 20 CE credits for New York certified peer specialists are available for free. And you can learn more about that with the link below here, ida-nyc.org, core curriculum-CE. So I'm going to share, or I'm going to invite our panelists to come on and just share very briefly a few words about their contributions to the curriculum. So Arita, if you want to share.
Yeah, thanks so much. So in these presentations, musings, thought projects, I talk about the kind of power dynamics around storytelling and the history of how we are often fed a dominant story, right? And the importance of the stories of everyday people who are most impacted by systemic oppression, the importance of those stories to really understanding systemic oppression and what it means to resist the dominant narratives that we're told about the communities that we come from, especially those narratives that perpetuate our dehumanization. I talk about lineages and histories, and especially lineages from Black feminist traditions about the healing power of storytelling. And then I also talk about this relationship between the individual and the collective that I talked a little bit about today, but just the relationship between individual healing and collective liberation, and how each of these concepts are really related to like the stories that live within us, but also breaking silences and the concept of witnessing other people's stories as well.
Thank you, Arita. And next, Roxy, if you want to share briefly about your lesson.
Yeah, thanks, Noah. In my lesson, I talk about sort of art therapy as a field, and look at sort of some of the history and like limitations and critiques, sort of as I see them, but also the potential and the need to really engage art making and creativity in our movement building and in our healing practices, and sort of circling that art making and creativity and radical imagination are part of our movement work.
Thank you, Roxy. And next is Chaku.
Thanks, Noah. And so I had an opportunity to put together a history of our Mad Liberation movement and our peer support evolution in a number of ways. So I was excited to be able to do that. So hopefully it provides an introduction, to those aspects of our movement. Thanks, Noah.
Thank you, Chaku. And last but not least, Peter, you want to talk briefly about your lessons?
I have a contribution about the history of IDHA, which was born in the moment of mutual recognition of expertise and experience that led to an unbelievable development in what, 8 years, is it, or 7 years? So I have the honor to contribute a little bit about that. And then, Soteria is an example of a model that is technically suited to help support people in extreme states. And I feel that that's an important distinction between some of the other models, peer respite. There's a blending of quote unquote clinical and peer support in this model. That's always, to me, very interesting how to pursue that. That's also true about open dialogue, peer supported open dialogue. So the idea of clinicians who are not self-identified as survivors and peers who are identified as collaborating in an environment of support and mutual support for people in extreme crises, I think is a very important and powerful idea, which has been quite not only neglected, but like expressively rejected by psychiatry, because psychiatry feels that there's a real chance there that much of what goes on in psychiatry today, hospital psychiatry, institutional psychiatry, could be replaced by support services such as that. And that's a big threat to the edifice of carceral psychiatry.
Thank you, Peter. So yeah, like I said, if you are interested in learning more and engaging with the work of these amazing faculty, we highly recommend to enroll in the core curriculum. Learning experience format is limited number of seats, so we recommend you enroll early. The registration closes Friday, August 30th at midnight. And I wanted to make an exciting announcement that we opened a new cohort. We're going to open this new one Mondays from 6 to 7:30. So definitely get in there and enroll. And self-pace is not capped on this format, so it's open year-round. You can enroll whenever, and you can visit the link in the chat to enroll. Yeah, and would be really excited for you to join us. We really believe in this curriculum, and we believe in all the faculty who contributed to it. So yeah, enroll and also share with your friends. So for the event, I just wanted to share that we have this feedback form, so we would love your feedback. We always want feedback about our programming. And you will receive in a follow-up email the event recording, the closed caption transcript, and the event feedback form. And yeah, if you are interested in being part of a community of mental health change makers, we highly recommend becoming a member as well. To do so, you can fill this short form out on the website, affirm our principles and values, abide by the community agreements, and pay an annual due, which is tiered at sliding scale. And you can do that with the link in the chats. These are some links to stay in touch with us, our website, our Instagram, Twitter, and Facebook. Thank you so much for such a inspiring event, panelists and moderator. Yeah, just filled with a little bit of hope. So feeling that tonight. Thanks everybody. Take care.